Welcome to the Basic Medication Administration Training class by Marie Evans Murat. We're going to follow the One DeSantis Governor class step by step done by APD Director Barbara Palmer.
Today we're going to talk about Rule Chapter 65G-7, which includes 12 different rules. These rules will describe the requirements unlicensed staff must meet in order to assist clients of APD by supervising the client's self-administration of medicine and administering medicine to clients. This training, of course, is only one of these requirements. The question comes, how do I become medicine assistance provider? Other words, MAP. These are the steps that are required. You're going to take the basic medicine administration training course, which is what you're in now, include passing the validation for OTIC, tropical by simulation, take the test and pass it and receive a certificate. In an on-site setting with actual clients and their medications, successfully demonstrate your skills with a validation trainer and then receive your certificate. The annual requirements are to take the Basic Administration Medicine Annual Update, pass, get a certificate online or in an updated provided APD regional office, or revalidate with a validation trainer and receive a certificate. Regarding this basic medicine administration training class, the purpose is to train unlicensed staff who work with clients of the Agency for Persons with Disabilities, APD, to safely assist clients with their medication, mainly to familiarize participants with their procedural aspects of the Florida Administrative Rule, Chapter 65G-7. This course must be taught by an APD-approved trainer using this APD-provided training material. Only licensed nurses, LPNs, RNs, APRNs, will be approved to teach this training course. And your trainer is Marie Evans Murat, a registered nurse. In order to complete this course, you must be present the entire time of the course being taught. You are not allowed to text with your phones, browsing on the internet, reading on any electronic devices, as your attention is totally required to understand this material. You must obtain a score of 85% or above on the course content section of the exam and obtain a score of 100% on the medicine administration record section of the exam. You will take a two-part agency-provided exam within 3 calendar days of completing this training. You will validate your skills by simulation on the OTIC, which is the ear, transdermal, and topical routines of medicine administration. If the individual is unable to pass the exam, the trainer may permit them to retake the exam once, but it must be within 3 calendar days. Upon successful completion of this course, you will receive a certificate. This is the only applicable, acceptable certificate for this course. You must include the dating date. It must include the training date. It must include the APD approved trainer number, must be signed by the trainer, and must include the trainer's nursing license and expiration date. When you receive your certificate, you should keep it in a very safe place. Do not give the actual certificate to your employer. You must make a copy and give that to your employer to keep on file. When you validate your optic, transdermal, and topical by simulation, you will also receive a validation certificate, partially filled out. We will discuss this later in the training.
Please keep your certificate all the time.
This training provides guidelines for unlicensed direct care staff serving clients with developmental disabilities in group homes, adult daycare programs, foster and family homes, independent and supported living, and any other place that clients receive APD services.
Except for ALF. There are APD clients that receive APD service in ALFs, but medication administration in the ALF is governed by ACA, and the rules are different.
Guidelines include when supervision of self-administration of medicine by unlicensed direct care staff is appropriate, rules and instructions for supervising the self-administration of medicine, when the administration of medicine by unlicensed direct care staff is appropriate, rules and instructions for administering medication, how to safely administer medications by oral, external, topical, transdermal, rectal, inhaled, ophthalmic, optic routes of administration, how to handle basic medicines safely, how to prevent medicine errors, when and how to report any concerns or errors. Rule 65G-7 does not apply to clients who are authorized to self-administer their own medications without supervision, although their medications may be stored following procedures from 65G-7. Family members or friends who assist clients with medications without being paid to do so. Healthcare practitioners whose professional licenses include administration of medicine, except for some requirements about documentation which are described in the rule. Anyone who is employed by or under contract to intermediate care facilities for those with developmental disabilities, home health agencies, hospices, assisted living facilities, ALFs. Healthcare professionals are required to document on the same forms that you will be completing. Course objectives for this course is 1. Understand the requirements for validation. 2. Demonstrate the ability to accurately complete and maintain all forms that are required. Objective number 3. Understand the rules for authorization for medicine administration and for informed consent for medicine administration. Number 4. State and demonstrate the rights of medicine administration. 5. Discuss and demonstrate correct supervision of self-administration of medicines. And objective number 6, demonstrate the ability to look up information on commonly used medications. Objective number 7, demonstrate the understanding of medicine instruction by reading and following instructions on a prescription label or healthcare practitioner's order. accurately transcribing prescriptions or orders to the MAR, which is called the Medicine Administrative Record. Correctly documenting on the MAR when medicines are given or missed. Objective number 8, understand the requirements for giving PRN as needed medicines. Number 9, demonstrate the understanding and safety of sanitation procedures. Objective number 10, demonstrate understanding of proper positioning of clients for medicine administration. Objective number 11, demonstrate the correct preparation and administration of medicine by oral, enteral, topical, transdermal, ophthalmic, octic, rectal, and inhaled routes. Number 12, understand the steps to take if a medicine error has been made. 13, understand the rules for storage of different medicine types, including prescription, controlled, and over-the-counter. Number 14, demonstrate the proper disposal of expired or discontinued medicines. Number 15, understand the steps to follow when medicines go off-site with the client. Objective number 16, validate medicine administration skills by simulation for the octic, transdermal, and topical routes of medicine administration. Validation is a demonstration of your ability to administer and supervise the self-administration of medicine, and a demonstration of your understanding of the other requirements and procedures that are involved when assisting with medicines. You must validate in an actual on-site client setting with actual clients using the client's medicines for the following routes of medicine administration: oral, internal, ophthalmic, inhaled, rectal.
These routes must be revalidated yearly. Every year we have to redo it.
Something to think about. Are all the routes I need to be validated on available with these clients today? What should I do if there is one getting a rectal or an inhaled medication right now?
Listen to the answer, please, Tommy.
If there are no clients who have medicines by a certain route, how do you validate for that route? You cannot validate for a route that requires on-site validation if there is no client on-site taking medicines by that route. If the client is later prescribed a medicine by that route that you are not validated for, a validating trainer will have to come back and validate your skills on that specific route. Primary route of medicine administration. You will see the words primary route on your validation certificate. Either the oral route or the internal route will be called your primary route. It is important to choose the route that you will be most often using when assisting clients with medicine administration. For the most MAPs, this will be oral route. But if your work is with clients who get most of their medicines through gastric tubes, then you would circle the internal route. The date of your first validate for your primary route will be your validation effective date, used to determine if lapse of validation has occurred. The annual expiration date of your validation each year is by month and day of your validation effective date. In other words, your validation will expire yearly on that same date. If you do not revalidate before that date, your validation will be considered lapse. If a lapse in your validation occurs, you may not give medicine by any route until you have taken this course again and revalidated your skills.
That only the primary route has an annual expiration date that remains the same, and your primary can be only oral or enteral. The three other routes that may be stimulated, up, topical, and dermal, do not expire once validated, unless the primary route lapses.
The other routes, ophthalmic, inhaled, rectal, or and either oral or external, whichever is not the primary route, will expire 1 year from the date they are earned. If a map was able to validate on these on the same day as the primary route, they would expire on the validation effective date, but this is very unusual. Most of the time, all of the routes are not available, simply because no clients are taking medicine by these routes. Sometimes several maps are trying to validate at the same time. Validation of routes of medicine administration. There would be a certificate with initials and date for the primary route and the other route. You would be circling the one your primary route, which most likely will be oral. This is the section of the validation certificate where the routes you will use to administer medicines are validated. The validation trainer will circle your primary route and observe you administering or supervising the self-administration of medicine for that particular route and any others that may be available at that time. It is always a good idea to get your validation for as many routes as possible each time a validation trainer is available at your site. You never know when you might need them. The right one-time validation by simulation box you will try to complete in this class today.
And you're going to have a new validation for the primary simulated routes can be brought forward. That means we can bring the date we have in the old one to the new one. But the map needs to keep the old validation certificate in order to be able to supply the expiration dates for the rest of the route, like rectal, inhaled, ophthalmologic, and either one. This must be easily accessible on request. Okay.
To validate by simulation will mean that you will give pretend medications to pretend clients in this classroom type setting in order to test your ability to administer medicines by 3 different routes. These routes are the only ones that may be validated by simulation, which include the optic, transdermal, and topical. These 3 routes do not need to be revalidated as other routes do unless your validation lapses. In that case, you would have to retake this course again and receive new validation by simulation during the course for these 3 routes. The demonstration of these competencies will be done on an on-site setting with primary route validation. The validation trainer will validate your abilities and skills with the following: Applicant has valid basic medicine training certificate for training completed in the last 180 days before initial validation. Demonstrates the ability to comprehend and follow medicine instructions on a prescription label, a physician's order, and properly complete the MAR form, including transcription of prescription to MAR. Demonstrate the ability to obtain pertinent medicine information, including the purpose of the medicine, its common side effects, and symptoms of adverse reaction to medicines. Demonstrates the ability to write legibly and convey accurate information in a manner that ensures health and safety and well-being of clients. Comply with the Medicine Administration record-keeping requirements. You will need to be able to demonstrate the knowledge of proper storage, handling, and disposal of medicine, including special requirements for controlled medications. You will need to be able to demonstrate the knowledge of requirements obtaining authorization for assistance with medicine administration, authorization for self-administration of medicine with supervision, and informed consent for medicine administration assistance. Also, you'll need to be able to demonstrate adequate training on the correct positioning and use of adaptive equipment or use of special techniques required for proper administration of medicine. And finally, you'll need to demonstrate the ability to communicate in a manner that permits healthcare providers and emergency responders to adequately and quickly respond to any potential emergencies. Temporary validation. If a client is prescribed a medication by a route that is the map has not been validated, the map may attain a temporary validation if the medicine is necessary to ensure the health and safety of the client. There is no other map who is validated for this route and available. Give it when it's needed. A nurse or physician documents the validation on a temporary APD validation certificate or on their own letterhead. Temporary validations are time and route limited. MAP must seek validation from an APD approved trainer as soon as it's possible. Temporary validation may not be used for prescribed internal formula administration. Temporary validation is good for one route, one client, and not longer than 30 days. Now, you may have a question. What is revalidation? Revalidation is the same process of validation. You must validate your skills with a validation trainer annually within 60 days before the validation expiration date on your current validation certificate. You cannot attempt to do it sooner than that. You must demonstrate annually to your ability to give medicines by the oral, internal, ophthalmic, inhaled, and rectal routes. You must demonstrate annually your knowledge and ability to perform all requirements in the competency checkbox section of the validation certificate. If you do not revalidate at least your primary route before the validation expiration date, your entire validation will lapse and your you may not administer medications of any route, including the simulated routes, until you have taken this course again and gone through the entire validation process. To revalidate, you must complete your basic medicine administration annual update by an APD, provided by APD, and you must revalidate at least your primary route within the 60 days of completing the annual update. Time to take some practice here. So what we're going to do is break into small groups. Each group will receive a scenario from the trainer. Groups will discuss their scenarios, and one presenter from each group will present the scenario with the class discussion. So we are going to ask you to stop the video now while we do this classroom activity. Once the classroom activity is done, you'll press play again to continue this course. Welcome back from the activity, and now we will continue the course. Determining the need for assistance, authorization for medicine administration. This is APD Form 65G7.002A. It's the authorization for medicine administration. Different clients will need different levels of help with their medicines. How do you, the MAP, know how much to help to give? This authorization form will tell you. This must be filled out by the client's MD or DO, the physician assistant, or advanced registered nurse, APRN, annually, or with any change to the client's medicine condition and self-sufficiency. There are 5 different levels of need on the authorization form. We will discuss each of these over the next few slides. We're going to discuss level 1 first. Fully capable of self-administering his or her medicines without supervision. That means that they can take their own medicines by themselves without supervision. No medicine administrative record or MAR is kept because the MAP can only document what he or she actually does, and they are not giving or supervising the medicine for these clients. Client may be reminded that it's time to take their medicines, and the client medicines may be brought to them if they're centrally located. They may need assistance to reorder the medicines or to get them from the pharmacy. They are allowed to use a pill reminder to store medicines, but the MAP may not help fill these pill reminders. If living in a group home or multi-purpose supported living environment, they must keep their medicines in a locked storage area within their room. Under certain circumstances, they must keep the medicines in central storage while all other medicines are stored. The reasons why client medicines are centrally stored would be that the client's health practitioner documents that the medicines in the client's possession would threaten health, welfare, or safety of other clients. The client does not keep their medicines in a properly locked place. The MAP, or the administrator of the facility, or APD, decide that the physical arrangements in the home or habits of other residents may make it unsafe for the client to keep the medicines on their own. The client or other authorized representative ask for the medicines to be centrally stored. Clients who do not require medicine assistance or live in their own homes with no clients are not required to keep their medicines locked up. Level number 2. Requires supervision while self-administering their own medicines. This means the client needs the assistance of a MAP or a licensed healthcare professional in order to take their medicines. The MAR has to be used as documentation of assistance. Assistance will be the same for every client, as each client needs to be encouraged towards independence. Some things the MAP may not may need to assist with are prompt the client, observe taking the medicine, confirm that the client is taking the correct dose, check the label of the medicine against the MAR and the order, open the medicine if the client is not able to do so on their own, discuss the medicine with the client to make sure they fully understand what they're taking and why. Medicines must be centrally stored. Supervision and self-administration includes instructions or any other assistance necessary to ensure the correct self-administration of medicines. A client may not be able to self-administer some routes, but need to have others administered. May be able to apply topicals and patches to easy reach areas, but need it applied for them on other areas. Level number 3 requires medicine administration. MAP must prepare and give all their medicines. MAP must document the medicines on the MAR immediately after they give them. Goal is still to help clients to become independent in their medicine. The MAP can do this by helping the client to rub a topical medicine by themselves. Tell the client the name of each medicine and the reason why they're taking it. Ask the client to help count their medicines or work on learning how many of each medicine they take and how often they take it. Let the client pop the pills out and take them out of the bottle if they can safely do so. Medicines must be centrally stored for these clients of this level. There are 2 more levels, and the final 2 levels of need are very similar. Level 4 requires medicine administration with the following exceptions, which the client is fully capable of self-administering without supervision. And the level 5 is requires supervision of self-administration of medicine with the following exceptions, which the client is fully capable of self-administering without supervision. Specify routes and specify route. Each of these requires the administration or supervision of medicine, but the healthcare professional makes an exception for a route the client can be independent within. This can be anything from topical medicines, they often apply, inhalers, or pre-measured insulin injections that they give themselves each morning. These medicines are treated just like medicines of a client who administers medication without supervision. You don't document them on the MAR. The medicines are not required to be centrally stored, but they can be. And you may retrieve the medicines for the client and remind them that it's time to take them. Before we go to the next activity, these are the levels of need that you're going to use for activity 2. 1, fully capable of administering own medicine without supervision. 2, requires supervision when self-administering their own medicine. 3, requires medicine administration. 4, requires medicine administration with the following exceptions, which the client is fully capable of self-administering without supervision. 5, requires supervision of self-administration with the following exception, which client is fully capable of self-administering without supervision, with specifying routes. It is a time for another activity, putting it all together. We're going to break into small groups. Each group will receive a scenario from the trainer, and the groups will discuss their scenarios. One presenter from each group will present the scenario with the class discussion. So at this point, please click stop, and when you're done with the activity, you'll press play again. Welcome back from the activity. Now, before a MAP may administer medicines to an APD client, the client or their legal representative must give their informed consent. In it, they acknowledge that the provider will provide medicine assistance, is not licensed or authorized to practice nursing or medicine. The form also informs them that the provider has had this training and is validated annually for competency. This informed consent is very important that the client's file at the location has it. The medicine is administered at the client's location. It should be updated annually. The provider referred in this form may be a group home, an ADT, or a single person depending on the circumstance. Once signed, it covers all MAPs employed by that provider. Please note that the MAP or any employee of the provider may not sign this form as a client's representative. They may witness it, however. The MAP cannot be signed by the client's representative because they are the ones giving the medicines. This would present a conflict of interest. So again, it must be signed by a representative or the client, and the representative cannot work for the facility. The 7 rights of medication administration. The right client. You must confirm the identity of the client if you're not sure. Do not assume. Ask the client what their name is. Be careful though, if you ask is your name Marta Spring, instead of letting them tell you their name, the client might smile and nod their head, or say yes, when that is not their name. They could have a hearing deficit, or do not really understand what you're asking. The right reason, especially for PRN as needed medicines. If a medicine is ordered for sleep, you may not give it for agitation in the middle of the day. If it is ordered for a fever over 101 degrees, you may not give it for a headache. However, if the medicine is ordered for a fever over 101 or pain, it could be given for fever, headache, or any other pain. The right medicine. Is the name of the medicine the same as the name of the medicine that is on the prescription or the doctor's orders? What should you do if they're not? Obviously, you will need to follow up. The right dose. Are you giving the amount of the medication that has been prescribed? Check the number of milligrams, mgs, or other units, mcg, IUs, etc. to make sure the dose that you have matches the doctor's orders or the prescription. You might need to break a scored pill in half or give 2 capsules to get the right dose. Right time. Medicine should be given on time. On time means that medicine should be given within 1 hour before to 1 hour after the scheduled time. Be very careful to give the right time of the day. It is necessary to give the medicine ordered for 9 p.m. in the evening at 9 p.m. Or if it's the morning medicine at 9 a.m., it must be given at 9 a.m. Some medicines must be given at specific intervals, so you may not interchange the schedule for these medicines for the convenience of the client or the MAP. The right route. Make sure that oral medicines are swallowed. Eye drops are dropped in the eye. Ear medicines in the ear. We must make sure we use the right route. Right documentation. You must document on the MAR immediately after giving each client their medicine. You must document missed medicine correctly and document on PRN medicines when they are given. What the response to the medicine is must be documented as well. These are the 7 rights of medication administration. This is the medicine administration record, known as the MAR. This is the only proper font for the APD MAR. Often you will use a different MAR provided by a pharmacy, or perhaps you will use a MAR that is provided electronically on a computer. All MARs are used for APD clients must contain the same elements as on the official APD MAR. No matter which MAR you use, the goal is to accurately document medicines that you give. The MAR is known to be the document that you will document medicine administration. If you complete the MAR correctly, you will be documenting that you observed the 7 rights of medicine administration. You acknowledge that this has been done. Using the MAR will help you stay organized when assisting with medications, whether you're supervising self-administration or administering the medicine. We will also discuss the MAR in more detail later on in this class. Medicine Administration Record MAR continued. This is the back of the MAR. Be sure to write the name of the client on the top. On this side of the MAR, you will document scheduled medicines that are not given, and the information about PRN as needed medicines, when they are, why they were given, what the response was to them. It is acceptable to attach more than one back of the MAR to the front if it's needed. We will, of course, discuss this even in more detail later on in this class. What do you do when the healthcare practitioner orders medication? These are some important steps that you need to be aware of and make sure you follow. You must obtain a copy of the order or prescription from the medical office or from the pharmacy. Take the prescription to the pharmacy if the medical office did not transmit it there. Keep copies of all current prescriptions in the client's MAR for reference. Write the new prescription order on the client's MAR. The prescription should match the label on the medicine, as well as should match the MAR. New medicines should be started within 24 hours once they've been prescribed, unless the prescriber orders give you a different start time. Sometimes, though, it is difficult to get a copy of the prescription because the medical office will transmit it directly to the pharmacy by phone, fax, or electronically. Therefore, you will need to ask them for a copy of the prescription while you're in the office with the client. If the medical office does not want to give it to you, it may help you to explain why you need it for your MAR. If the new prescription is sent to the pharmacy with no visit to the doctor, or the doctor won't give you a copy, ask the pharmacist for a copy of the prescription. The pharmacy may give you a copy of the physician's order summary, POS, with a list of current medicines, order date, ordering doctor, and instructions. Discontinued prescriptions should be kept in the client's file for future reference. Start new prescriptions within 24 hours unless they've been ordered differently by the prescribing doctor. Prescriptions should be written on the MAR as written by the prescriber, with the exception of abbreviations such as QD, PO, PID should be spelled out instead of using the initials. Usually this is done on the medicine label from the pharmacy as a double check. What is missing from the prescription above? Take a look at the prescription and see. As you will see that it does not explain how the client will take it. Again, all parts of the prescription must be clearly identified on the prescription or doctor's orders. Understanding prescription medications and medicine labels. A prescription is simply a written order by a licensed healthcare professional for the preparation and use of a medicine. Only licensed healthcare professionals may prescribe medicines. These licensed healthcare professionals include the medical physician or psychiatrist, that's an MD, osteopathic physician, known as a DO, advanced practice registered nurse, APRNs, physician assistants, PAs, dentist, either a DDS or a DMD, optometrist, OD, or a podiatrist, Doctor of Podiatry Medicine, DPM. You may see a prescription written as RX, which is the abbreviation for prescription. Once the prescription is written, it is usually transmitted or delivered to the pharmacy so that it can be filled by a licensed pharmacist. What is a licensed pharmacist? Well, a pharmacist is a professional who dispenses, labels, and packages medicines as ordered by a licensed healthcare professionals. Pharmacists can also prescribe certain medications. Pharmacists often alert patients of potential drug-drug or drug-food interactions. The pharmacist that provides your clients medications is a good resource to use if you have any questions about the medications or how to give it. Many pharmacists also provides MARs for the clients or provides an electronic MAR. Prescription medicines are either a brand name or a generic name. Generic medicines are usually less expensive than the brand name, and many healthcare insurance plans require the generic medicines to be utilized. And examples of these include Lipitor, the generic name Atorvastatin, Prozac, generic name Fluoxetine, and there's others as well. Sometimes the person, though, will need to take a brand name medicine if the generic does not produce the desired result. Prescribers and pharmacists are aware that some medicines don't perform the same way as their generic forms for some people. For others, they work just fine. This is most often noted with seizure medicines and some medicines for mental illness. You have to be diligent if the prescriber writes a brand name only to make sure that it is only what your client receives. You will see a spot on the prescription that allows the prescriber to check dispense as written. If that is checked, the prescription or RX must be written for the brand name, and the client should only receive the brand name. Over-the-counter medicines commonly come in generic versions as well. Medicine labels. It is important to understand how to read a medicine label. The elements from the label that must be on the MAR: the medicine name, strength, and dosage form. Directions for use, written out, no abbreviations. Instead of every day, it would be better to give a time or indicate morning or evening. the prescriber's name, and the client's name. On this label, you will see a description of what the medicine looks like down at the bottom. Pharmacies may change the supplier of their generic medicines, so the medicine may not look the way you expect it to look. Check the box to verify that you have the correct medicine. The pharmacist may have dispensed the wrong medicine. What other information is on this label? When did this drug expire? These are important. You'll notice that the expiration date is listed, as well as how many refills left. A label for a time-limited medication. This medicine is an antibiotic. It is time-limited. You can see this in the directions. 3 times a day for 10 days until all are taken. A time-limited medicines do not require an order to discontinue. The end date is on the original order. You will learn how to document this medicine like this, that you may start and end in the middle of a month. Your trainer for this course will demonstrate how to block out the days on the medicine that is to be given on the MAR. You will need to pay attention to the labels the pharmacist put on it. These are auxiliary labels. Also, we call them warning labels. They give you important information about how to take the medicine and about things you should or should not eat or drink with the medication. You will also find this information on the side effects and activities to avoid. Some of these labels may be confusion, so sometimes you may need to ask the pharmacist if you're not sure what the label actually means. Some examples include shake well before using, may cause drowsiness, take with food, or for the nose. Again, if you're not sure what these mean, you should always ask the pharmacist for more explanation. Order changes. Healthcare professionals often will change the medicine orders based on a client's response to the medicine or change to their condition. The dose may be increased or it may be decreased. The number of doses given per day may also change. The time of administration may change, maybe from morning to the bedtime, for example. One drug may be stopped and another one is prescribed in its place. All medicine changes must have a written prescription or doctor's orders from the client's healthcare practitioner. This order may be faxed to the facility, or you may get a copy of the order directly from the pharmacy. Any change requires a new entry on the MAR. That means a new line. Whenever a client is discharged from any facility, whether it be inpatient, rehab, psychiatric, emergency room, urgent care, or any other facility, they will usually have new medicine orders. It is very important to the client's safety that these orders are reconciled with the client's current medicine orders. You must call the client's primary care provider within 24 hours to reconcile the client's current medication orders with the new orders provided on the discharge from the facility. You must document that you made that call and that response that was given by your primary care provider, including all instructions for medicine and follow-up care. If you do not get a response from the provider, you must document that along with continued attempts until you can contact that provider. If there is no nurse there to take verbal instructions from the primary care provider, you are required to ask the provider for faxed or electronically supplied instructions. The place for documentation of calls to the primary care provider is not specified in the rule. It could be in a daily logbook that is kept for the client or a piece of paper that you add and staple back to the MAR. Any facility should be consistent and do it the same way for all clients. Staff should be able to produce the documentation whenever it's asked. Only nurses can take verbal orders. This is why the provider is asked to fax or email instructions in the absence of a nurse at the facility. Sample medications. No prescription medicine may be kept unless it is properly labeled and dispensed. Sample medications are often given, sometimes in packages, intended to be a starter dose for medicines that need to be started slowly. Sample medications must have a prescription with them or a label signed by the prescriber that has the client's name, the prescriber's name, and give directions for administering the medicine. This label can be as simple as having the information written on a sheet of paper that is kept in the bag with the samples. The map must initial the label and add the date of medicine when it's opened. Samples must be kept in the original containers. If a starter pack with different doses, like the one shown on the side, is used, each dose must be on a separate line of the MAR. Sample medications may be kept together in a bag, clear Ziploc preferred, with a copy of the prescription or written information directly from the provider. Things to remember. A map may not transfer medicines from the original container to any other container such as a pill minder or medication box. A map may not make changes on the prescription label. If a prescription label or order instructs to give a medicine as directed, you need to get more specific instructions from the prescriber before the medicine can be given. This includes orders such as use shampoo as directed. Is this once a week? Is the shampoo applied to wet or is this applied to dry hair? Apply ointment as to affected area as directed. When the affected area, how often do we apply? How much? Give one tablet nightly as directed. Probably means give nightly, but could mean as needed or specific time or with a full glass of water. How would you know this? It is important that these instructions is written in details so there's no questions at the end. PRN medications. PRN medications can be prescribed or over-the-counter medicines, often called OTC. They must be ordered by a licensed healthcare provider and written instructions for their use must be given. PRN means as needed. PRN medicines is given only when needed, only for a specific reason it was prescribed or ordered. If a medicine is ordered for a headache but not fever, you may not give it for a fever. If a medication is ordered for sleep, you may not give it for anxiety. Must be correctly documented when given. Response to the medication must also be documented. PRN drugs may only be given for the symptom. You may know that Tylenol is great for a fever, But if you have only Tylenol ordered for pain, you cannot give it for a fever. You must document the symptom the client has and that reason as the reason why you're giving the medication. PRN medicines require certain parameters. What are parameters? Parameters is a set of facts which describe and limit how something should be used or done. The healthcare practitioner must give written instructions or parameters for the PRN medicines, a prescription or an order which has the following information: the name of the medicine, the exact prescribed dose, not give 1 or 2 tablets or give 2 or 3 puffs. It must be specific with the exact dose. The specific time intervals for giving the medicine, not every 4 to 6 hours. It must have, again, specific time intervals. Which administration route the medicine is to be given by. Specific directions for use, including the medical reason or symptoms for the medicine, the maximum number of doses per day, the maximum number of days the medicine should be given. Any conditions under the prescription should be noted. Orders requiring judgment. Because MAPs are not licensed healthcare professionals, they may not supervise or give any medication that requires judgment calls. A MAP should not be allowed to assist a client with this order. Lasix, 40 mgs by mouth, PRN, for fluid retention. A MAP is not trained to assess whether or not the client has fluid retention. The prescriber would need to clarify this order. Correctly written, it may look like this: Lasix, 40 mgs by mouth each morning, PRN, for fluid retention, as evidenced by weight gain of 2 pounds or more within 24 hours. Client must be weighed each morning at the same time. Call the MD if the weight gain is 5 pounds or more in 24 hours. If needed for more than 3 days in a row, call MD before giving the 4th dose. As you can see, the correctly written explains exactly when and how to use the medicine and what length of time before you need to call for further instruction. This is very important to understand. Over-the-counter medication, known as OTC, widely available at pharmacies, grocery stores, convenience stores, and elsewhere. Clients may take these as regularly scheduled medicine. Low-dose aspirin, vitamins, stomach drugs like Prilosec are some examples of these. Over-the-counter medicines are frequently used as PRNs. Tylenol, ibuprofen, Colace, cough syrups, medicine ointments are commonly known as PRN OTCs. Group homes, ADTs, and supported living arrangements with more than one client may keep a stock supply of these OTCs for use for more than one client. OTCs do not have to be labeled by a pharmacist, but require a specific order from a healthcare practitioner, which must be followed exactly. Controlled medications are divided into 5 schedules, Schedule 1 through Schedule 5. Abuse potential is considered to be highest with Schedule 1 drugs, which have no currently accepted medical use in the United States. with only limited abuse potential for Schedule 5 drugs. Example, Schedule 2, Ritalin, codeine, fentanyl, oxycodone, morphine. Schedule 4, phenobarbital, Valium, Ativan. Controlled medications must be double-locked and counted as required by 65G-7.007 sub 5.
Later on, we're going to show you how to double
This is the controlled medicine count form. When controlled medicine is received, the top of the form is filled out, including the initial number received, the initials of the MAP or nurse who verify the amount is correct. Each supply of controlled medicine gets a new count sheet. Each time medicine is used, a line is filled out on the sheet. At the end of the shift, 2 MAPs, or 2 nurses, must count an initial to verify the accuracy of the last entry of the highlighted number remaining column. MAPs and nurses sign and initial the bottom to identify their initials in the columns above. Remember, all controlled medicines must be present and counted. This includes medicines that have been discontinued, but is still stored at the facility or waiting for the destruction, or new monthly supply that has not been put into use. All controlled medicines must be double locked, whether they are in use or not. A new count sheet is used for each new supply and package of controlled medicine. If a client is delivered a medicine that is supplied in 2 bingo cards, one for AM and one for morning PM, then each bingo card would get its own count sheet. How to use the controlled medication count. When a medication is first received, you will fill the top of the sheet and verify the count. Each time the medicine is given, fill one line to identify who administered, the number on hand, number given, and number remaining. At the end of the shift, or daily count for facilities without shifts or only one MAP, the medication is counted to verify the amount of number remaining column is correct. In a facility with shifts, one MAP or nurse from each shift initials they have verified the count. If a daily count, one MIP and or initials, nurse initials, and the other date and time of the count. Note, the yellow box is not filled out each time the medicine is given, but when the medicine is counted. The right section of the form functions as countdown sheet, a format that many are familiar with. The yellow section functions as countability. Medicine packaging. Medicines come packaged in several different ways. You will need to know how to manage each type of packaging. This type of bottle is how most of us receive our own medicines. It is labeled as you would expect, and you remove the correct number of pills from the bottle by pouring it into a cap, then into the med cup. Most of us are familiar with how liquid medicines are packaged. These include eye and ear drops. In group homes and other places where clients live, medicines often do not come in pill bottles, and liquids are sometimes packaged in unit doses.
it's better for contamination as many doses and easier to use for the map.
Medicine packaging, known as bingo cards. There are many types of these. Some have only one type of medicine in them. Others have medicines that include more than one that a client may take at the same time and date in one little bubble. Both types often come with color codes for morning, yellow, noon, green, supper, light blue, bedtime, purple. Some are performed to allow clients' meds to go with them for one or more med passes. Make sure you understand what types of cards you are using. You may need to pop pills out of more than one. Also, initial and date the package when you start using it. All cards must be correctly labeled. If there are multiple medications, you must be able to identify all of them from the label's description. Medicine packaging, multiple medication dose packs. Multiple medication dose packs contain all of the medications the client needs for a single date and time. They will be packaged in bingo cards as you have seen in the past, often color-coded for the time of the day. Another form of multi-dose packaging looks like this: pills and capsules in perforated bags in a roll. The medicines come off the roll in the order they are needed. So you must be careful to start with the package for the right date and time. The box must be labeled to identify all the medicines included within the box, or each bag must also be labeled to identify the entire contents.
Please be careful with this kind of packaging. You have to know what to do.
Expiration dates of medicines. This is the discard date of the medicine. The medicine itself is too old to consume and may not be given. Expired medicine should be destroyed or discarded. You will learn how to do this later in this class. Expiration date of prescriptions. The prescription may not be refilled after this date, often written as a number of refills or the last date to refill. For example, refill 6 times until May 1st, 2019. This means after 6 refills or after May 1st, the medicine may not be prescribed unless the doctor gives new orders. A medicine with an expired prescription still may be given as long as the medicine has not reached its discard date. You must make sure the prescriber has been contacted and contact them yourself to ask for a new order. Receiving medications from the pharmacy. When you receive medication from the pharmacy for the client, it is a good idea to log them in, whether they are controlled or not. This is not a requirement of the medicine administration rule, but it is a great way to keep track of medications and ensure that the medicine label matches the MAR and matches the prescription. If you make a form like this to use for your clients, it may look something like this taken from the top part of the form that is currently used by some providers. Your form does not have to be just like this one. You may want to add a column for notes or for the name of the pharmacy or add time and date of the column. Whatever helps you and your employer keep track of the medicines arriving at your facility. If you choose not to use a form when receiving medicines, it is important to check the label, the MAR prescription immediately so that you have any of these problems. Again, it is recommended to use a form such as this. It is important to know that hand washing stops the spread of germs. You must wash your hands before and after each contact with a client between different routes of medicine that's been administered. Alcohol-based of at least 60% alcohol hand sanitizers may be used if hands are not visibly soiled or greasy. You must wash your hands often. The reason you wash between different routes of medicine is so that you don't take germs from the skin to the eyes, or from the mouth to the skin, or from the rectum to the ear. Even though you may wear gloves for many routes of administration, you can still get germs on your hands while taking them off, or when handling medicine bottles and tubes.
And don't forget, washing your hands is the best way to prevent contamination. It's better than alcohol, and it's cleaner and dry.
Here is the hand washing steps. You will collect soap. Avoid using bar soap if possible. Liquid soap is better. Paper towels and a trash basket. Turn the water on, adjust it to warm water. Wet the hands up to the wrist. Then apply soap using enough to create a good lather. Then you will spread the soap over the back and the front of the hands, up to the wrist and under the nails. Rub firmly with circular motions, including rubbing the fingers through each other for at least 15 to 30 seconds. The longer, the better. Try to go for at least 30 seconds. Rinse hands, avoiding contact with the sink and faucet area. Allow the water to run downward from the wrist area when rinsing. Then you should dry your hands with paper towels, or use the towels to turn the faucet off. If you're using hand sanitizer, the CDC recommends that you should contain at least 60% alcohol. The amount recommended on the packaging should be dispensed in the middle of the palm, and the same rubbing motion should be used as in hand washing, performed until the sanitizer is completely dry. Again, hand washing is the best practice and is always a good idea. It's when the hand washing is not available that the sanitizer becomes an alternative. Go ahead.
Avoid, avoid sanitizer panel because it.
Cleanliness and medicine administration. It is important to keep the area used to prepare medicines clean. Clean the counter surfaces often and wipe up spills right away. Keep liquid medication bottles clean by wiping up the drips and cleaning around the neck of the bottle with a clean wet cloth. The areas where the medicines are stored and given should be well organized with no clutter. They should be quiet, well lit, and away from places where people gather. A clean area free of clutter is not only more sanitary and free of germs, it also prevents medicine errors.
In a group home, it's better to use Kleenex, wipe it on the bottles in a wet cloth because we don't know if it's really clean.
Know your client. To safely assist a client, you must know them. It helps to include a picture of the client with the MAR for those times when someone less familiar with the client may need to assist with medications. Be familiar with the client's medical histories, medicines used, including those no longer taken, allergies, diets, and ability to swallow. Know where to find the name and contact numbers for the client's medical providers and pharmacy, just in case you have questions about the client's medicines. Understand the best positioning and adaptive devices used for each client. If you do not know how to position a specific client for medicine administration, ask your supervisor. Knowing your client sounds so simple, yet is not always easy. It is really important to have a good picture in the MAR, especially if they are staff that are not there often enough or may not normally work in that particular facility. Always listen to the client. Double check any questions he or she may have about the medicines that you're assisting them with. Be in the know. Know your client. Know what medicine you're giving. Know why you're giving the medicine. Know the side effects of the medicine. Know any specific instructions. Know what to do if there's an emergency. And know who to call if you have questions.
And please do call if you have questions. Pharmacists, healthcare practitioners, your supervisor, please do call for any questions.
It is now time to take a break. We're going to take a short break, so the video will be stopped and it will be replayed when the training resumes. Please listen to your instructor to how long the break will be.